Borderline personality disorder represents one of the most intense and emotionally challenging mental health conditions, affecting approximately 1 to 2% of the general population and occurring more frequently in females than males. This complex disorder is characterized by a pervasive pattern of instability in interpersonal relationships, self-image, emotions, and marked impulsivity that begins by early adulthood and presents across various contexts. The term borderline historically referred to the condition being on the border between neurosis and psychosis, though modern understanding recognizes it as a distinct personality disorder with its own unique features and treatment approaches. The diagnostic criteria for borderline personality disorder require the presence of at least 5 specific symptoms that create significant distress and impairment in functioning. These symptoms include frantic efforts to avoid real or imagined abandonment, a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation, identity disturbance with markedly and persistently unstable self-image or sense of self, impulsivity in at least 2 areas that are potentially self-damaging such as spending, sex, substance abuse, reckless driving, or binge eating, recurrent suicidal behavior, gestures or threats, or self-mutilating behavior, affective instability due to marked reactivity of mood with intense episodic dysphoria, irritability, or anxiety usually lasting a few hours and only rarely more than a few days, chronic feelings of emptiness, inappropriate intense anger or difficulty controlling anger, and transient stress-related paranoid ideation or severe dissociative symptoms. The development of borderline personality disorder appears to result from a complex interaction of biological vulnerabilities and environmental factors, particularly early childhood experiences. Research suggests that individuals with borderline personality disorder often have histories of childhood trauma, including sexual abuse, physical abuse, emotional neglect, or severe emotional invalidation. The biosocial theory proposed by researcher Marcia Linehan suggests that borderline personality disorder develops when individuals with biological vulnerabilities to emotional dysregulation grow up in invalidating environments where their emotional experiences are consistently dismissed, criticized, or punished. This combination creates a perfect storm that leads to the development of the intense emotional reactivity and interpersonal difficulties characteristic of the disorder. Neurobiological research has revealed important insights into the brain differences associated with borderline personality disorder. Studies using neuroimaging techniques have identified abnormalities in brain regions responsible for emotional regulation, particularly the amygdala, which processes emotions and threat detection, and the prefrontal cortex, which is responsible for executive functioning and emotional control. These brain differences may contribute to the emotional intensity, impulsivity, and difficulty with emotional regulation that characterize the disorder. Additionally, research has suggested possible genetic components, with studies indicating higher rates of mood disorders and personality disorders among family members of individuals with borderline personality disorder. Living with borderline personality disorder creates profound challenges in virtually every aspect of life. The intense fear of abandonment that characterizes the disorder can lead to desperate attempts to maintain relationships, sometimes resulting in clingy, demanding, or manipulative behaviors that ironically push others away. The pattern of idealizing and then devaluing others creates a roller coaster effect in relationships, where individuals may view someone as perfect one day and completely worthless the next. This splitting behavior stems from the difficulty individuals with borderline personality disorder have in seeing others as complex beings with both positive and negative qualities. The emotional instability associated with borderline personality disorder can be overwhelming for both the individual and those around them. Emotions are experienced with exceptional intensity and can change rapidly in response to interpersonal situations or perceived slights. What might be a minor disappointment for someone else can feel catastrophic to someone with borderline personality disorder, leading to extreme emotional reactions that may seem disproportionate to outside observers. This emotional volatility can create significant stress in personal and professional relationships, as others may feel like they are walking on eggshells to avoid triggering intense emotional responses. Self-harm and suicidal behaviors are tragically common in borderline personality disorder, with studies indicating that up to 75% of individuals with the disorder engage in self-injurious behaviors at some point. These behaviors may serve various functions, including emotional regulation, self-punishment, communication of distress, or attempts to feel something when experiencing emotional numbness. The high rate of suicide attempts and completed suicides among individuals with borderline personality disorder makes it one of the most dangerous mental health conditions, requiring careful assessment and ongoing monitoring by mental health professionals. The chronic feelings of emptiness that characterize borderline personality disorder can be particularly challenging to understand and treat. Individuals often describe feeling hollow, bored, or lacking a sense of purpose or identity. This emptiness may lead to desperate attempts to fill the void through impulsive behaviors, intense relationships, or other external means of finding meaning and validation. The unstable sense of identity associated with the disorder means that individuals may struggle to maintain consistent goals, values, or self-perception, leading to frequent changes in career paths, relationships, or life directions. Diagnosing borderline personality disorder requires careful assessment by experienced mental health professionals, as the symptoms can overlap with other conditions including bipolar disorder, post-traumatic stress disorder, and other personality disorders. The diagnostic process involves comprehensive clinical interviews, psychological assessments, and careful observation of behavioral patterns over time. Clinicians must differentiate between the chronic emotional instability characteristic of borderline personality disorder and the episodic mood changes associated with mood disorders or the trauma-related symptoms seen in post-traumatic stress disorder. Treatment of borderline personality disorder has evolved significantly over the past several decades, with the development of specialized therapeutic approaches that have shown remarkable effectiveness. Dialectical behavior therapy, developed specifically for borderline personality disorder by Marcia Linehan, combines cognitive behavioral techniques with mindfulness and distress tolerance skills. This approach teaches individuals how to regulate their emotions more effectively, improve interpersonal relationships, and develop healthier coping strategies. Other evidence-based treatments include mentalization-based therapy, which focuses on helping individuals understand their own and others' mental states, and transference-focused psychotherapy, which explores relationship patterns through the therapeutic relationship. The therapeutic relationship is particularly important in treating borderline personality disorder, as individuals with this condition often struggle with trust and may test boundaries or engage in behaviors that challenge therapists. Successful treatment requires therapists who are skilled in maintaining appropriate boundaries while providing consistent support and validation. Group therapy can also be beneficial, as it provides opportunities to practice interpersonal skills and receive feedback from peers who may be experiencing similar challenges. Family involvement in treatment can be crucial for recovery, though family relationships are often strained due to the intense emotions and behaviors associated with borderline personality disorder. Family members may benefit from education about the disorder, training in communication skills, and support for their own emotional needs. Family therapy can help improve communication patterns and reduce conflict while teaching family members how to respond more effectively to crisis situations. The prognosis for borderline personality disorder has improved dramatically with the development of effective treatments. Research shows that with appropriate treatment, many individuals experience significant improvement in their symptoms and quality of life. Studies indicate that up to 85% of individuals with borderline personality disorder achieve remission within 10 years, and many go on to lead fulfilling lives with stable relationships and successful careers. However, recovery typically requires long-term commitment to treatment and ongoing support, as the patterns associated with personality disorders can be deeply ingrained and challenging to change. Prevention efforts for borderline personality disorder focus on early identification and intervention, particularly for children and adolescents who have experienced trauma or show early signs of emotional dysregulation. Creating supportive environments that validate emotional experiences while teaching healthy coping skills can help prevent the development of more severe symptoms. School-based programs that promote emotional literacy and resilience may also play important roles in prevention efforts.